Everyone, once again welcome to my Oet channel. So today we will have another one role play discussion. This is happening in local clinic and you are going to talk with the baby's parent. You can see the setting. You see the parent of a 10-month-old baby boy. The child has a persistent rash on his buttocks. You have just examined, underline that point. You have just examined the child and diagnosed nappy or diaper rash. The child is not present for the conversation or the discussion. So what you can understand here, this is a non-case scenario because you have just examined the baby. But during the conversation, baby is not present. So what you have to do, and they have given already, this is a baby boy, so keep it in your mind or just underline or make a round over there so that the gender change will not happen. Here, what is the thing you have to do first? During 3-minute preparation time, you have to ask mother or father's name because you have just examined, so already you have started the conversation. So you can just ask her or him the name. Example, here you are going to talk with baby's mother. Mother name is Olivia. You can just write the name over the paper, then we can start the conversation. You can see the first task: confirm presence of nappy or diaper rash. Example, it's a severe case, common condition, not cause for concern, etc. Outline next step, discussion about changing routine, advice on prevention, etc. and find out any questions or concerns. So what we are going to do here, it's already started. The conversation already has started. So what you can do, well, Miss Olivia, thank you for allowing me to examine your baby's rashes area. Upon my assessment, I can tell you that he has presence of nappy or diaper rash. But no need to worry, even though it's a severe case, it's a common condition. During this age group, we can see in most of the babies with who is using the diaper, but there is no need for any concern. We can manage conservatively. Are you okay with that? So like that we can ask. And the next thing we are going to discuss about the following management. And for your further information, I would like to tell you that we can discuss about changing your baby's routine regarding the diaper changes and the usage, as well as I can give you some advice on prevention of the rashes also. Is it okay for you? Or is it okay with you? Like that we can ask. Then find out any questions or concerns. We can ask, do you have any concerns before proceeding? Then mother is telling regarding what may be the reason. So she may have many concerns. Oh sister, really I'm so much worried about his condition. I don't know how to manage these conditions and all. So we can give the reassurance again and again. I can truly understand you, Ms. Olivia. Being a mother, it will be a difficult situation if your baby have even a simple problem, but no need to worry, we are here to help you. Then the next task, we are going to the next task: give reason for your clinical opinion. It's a nappy rash. It varies in severity, confined to baby's buttocks, no fever and other symptoms. This is the confirmation. So we are telling that this is nothing to be worried because these things is happening. Reassure parent about crying or difficulty sleeping. By reading this one, you can come to know that parent has taught something regarding continuous crying and sleeping disturbances, right? This is known as hidden question. That means there is one question but it's not written there, so you have to ask them. Then the other thing, possibility of toothing or colic unlikely to be a concern. Make recommendations like monitoring baby. So what we can do here, we can ask, do you have any more concern? We asked already. Then the mother is telling that yes, actually I am so much worried about my baby's condition. Also he has difficulty in sleeping and he is crying continuously, so I don't know what is the reason behind of this. Maybe because of pain over these rashes, or maybe because of irritation of these rashes. Then we are giving the reason for our clinical observation, like an answer. Miss Olivia, so as I told you, from my clinical opinion, I can tell you that this is nothing but nappy rashes. It can be varies in severity among babies. and it is only confined to your baby's buttocks area. Moreover, as per your conversation, I can come to know that there is no fever for your baby, isn't it? Like that we can ask. Then we can give the reassurance. And you actually you have told me regarding baby's difficult sleeping and continuous crying, and there can be different reasons, not only because of baby rashes, these buttocks rashes. It can be maybe due to toothing or abdominal colic, like pain over the abdomen, maybe because of indigestion. But these are all like common conditions among this age group. You don't need to worry about this problem. Like, you can just monitor your baby, and if the problem is persisting for a long time, please get doctor's advice. Is it okay with you, or am I clear to you? Like that we can tell. Then our next task is find out about nappy or diaper changing routine, like frequency, type of napkins, diapers, use of soap or baby wipes, etc. So how we can ask the task means, Miss Olivia, before proceeding, I would like to ask you some questions regarding your baby's conditions and your routines. Is it okay? May I proceed with that? Like that we can ask. Then mother is telling that is you can ask. So what is the question? Could you please tell me about your baby's diaper changing routine, like how frequently you are changing, and what is the type of napkin you are using for your baby, as well as whether you are using soap or baby wipes for him. Then 3 questions we can ask together. So mother is telling that actually for the I'm changing the diaper and on demand, and I'm using the normal commercial diapers for him. I'm not using soap, but I'm using baby wipes after he passes stool. And then you can tell thank you for your information. Then our next task is explore details about treatment tried to nappy or diaper rash, like antiseptic cream, paracetamol, or acetaminophen. So that we are asking, we have to ask. Then we can ask that one more question. I would like to ask you that have you tried any treatment for him, like any creams or any medicines like syrup for him for the pain relief. Then mother is telling that I just applied only moisturizing cream over the area, and I have given paracetamol syrup because he's kind of crying continuously, so that's why I just tried that. Then we can tell that okay, it's fine. Then our next task is describe common strategies for preventing the rashes, like gentle cleansing of skin, barrier creams, avoiding perfume, soap, baby wipes, etc. So that is the same thing, only mother also informed. So you can just inform that I'm appreciating your action, what you did for your baby. And now I would like to tell you regarding the prevention of further rashes. May I proceed with that? Then we can continue with that. It is essential, you have to just concentrate on this area, because you are giving advices for someone, not for the patient. Okay, so your patient is baby, but you are talking to mother. So how we can tell? It is essential for your baby to use gentle cleansing of skin. Or we can tell it is essential for your baby's skin to cleanse gently and can apply barrier creams. Please try to avoid perfumed soap and baby wipes, because all these items contains chemicals which will irritate your baby's skin again. Are you following me? Like that we can ask. Then we can tell some suggestions also. And in addition, I would suggest you that means short period without nappy. I would like to suggest you to keep your baby without nappy or diaper for short period, because it will help for your baby's skin to breathe. It's like a breathing time for your baby's skin. So do you think you can do that, or you can ask how does that sound? Then mother may inform you that it's okay, fine sister, I can continue with all these measures, and I will see whether he has any improvements or no. Then this is a parents talk, so we have to give advices at the end also. So what you can tell? So I'm glad to know that you have agreed all my advices, Miss Olivia. Once again, I'm strongly what you can tell, it's like strongly recommending you to follow all my advices, and I'm reassuring you that if you follow all my advices, your baby's problem will resolve very soon. And thank you for your time here. Do you have any more concerns? Then if there is no concern, thank you for your visit here. If your baby's problem persists even after these advices, please come back here for doctor's appointment. Okay, thank you for your visits. That's enough. So with this one, we can conclude the recommendations and this role play. So keep it in your mind. If it is a non-scenario, in this case, you can see two peculiar thing. It is a non-scenario plus it is a second degree talk. You are talking to the parent, not to the baby or not to the patient. So you have to maintain that second degree talking manner, and this is a parent, so we have to reassure in between in the starting, in the middle, and the last also there should be reassurance. Of course, in the conclusion there should be recurrent reassurance. Please don't conclude like a simply with a thanks. Okay, so these are the things, keep it in your mind. So this type of questions can be expected in every OET exams, so please practice with your friends, so it will be easy for you to remember during the exam time. Okay, so we will see with another informative video. Until then, bye, take care.